Hi, my name's Allie, and I'm going to demonstrate the skill of measuring and recording intake and output. Measuring and recording intake and output is extremely important because it gives us an idea of the patient's fluid and electrolyte balance. This skill is especially important for patients who are post-op and major surgery, have any sort of renal kidney damage, CHF, diabetes, receiving IV fluids, or any other medications. The procedure can vary from hospital to hospital, so it's really important to check the policies and procedures of the facility that you're at. So in order to measure intake and output, you're going to need a measuring device, gloves, and to do your each and every time steps. So each and every time you enter the patient's room, you're going to knock, ask their name, and another patient identifier, usually their birthday. Okay, so say our patient, this is lying by their bedside, and we can see that it's 500 milliliters, so that would be our intake. We always measure in milliliters, not ounces. And then measuring output is a little bit more difficult. You're going to want that measuring device, make sure it's in milliliters. And remember, before you do this, you have gloves on. You've checked, make sure you have the right patient, all that stuff. And this is our bedpan with our urine in it. Okay, and we are going to pour it in there. Like that. Okay, and we're going to read that, and it's right at 900 milliliters. And so we would document that based on your hospital's policies and procedure. When you're recording intake, you want to make sure you're recording the fluid item, the time that it's recorded at, and the type of fluid that you are measuring. Oral fluids, tube feedings, IV fluids. And when you're measuring output, it's going to be following after each void. So that includes like your urinary output, vomit, feces, tube and wound drainage, all that good stuff. And then after you're done recording, you're going to dispose of it properly in the toilet, rinse it, and then dump it into the toilet again. Take and move it to the side, and yeah.